Hello and a very warm welcome to all of you. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be having a good time, having good health. Today we are going to talk about something which is very important. It is a very common chronic skin condition. Yes, I mean acne. June is also Acne Awareness Month, and throughout this month we have been trying to spread as much awareness on acne as possible. So today again we are here with a very new session with our skin expert of today's, and today we'll talk about what is acne, why it happens, who are more prone to having acne, what to do in case we have acne, and how to take care of it, how to manage acne. Plus, another very common saying in medical fields says that prevention is always better than cure. So is there any way we can prevent having acne? So these are the things that we'll try to talk during this conversation that we are going to have with our skin expert. So before we are joined by our skin expert of today's, let me introduce him to you. Today we are going to have Dr. Prateek Maharana, a renowned skin expert from Bargarh, Odisha. And he's a consultant dermatologist at Sarojini Skin Care in Bargarh, Odisha. Brings extensive expertise in dermatology, specializing in skin, hair, nail, cosmetology, leprosy, and STDs. With an impressive academic journey encompassing MBBS from Vimsar, Burla, MD DVL from SCB Cuttack, and DNB from New Delhi. He has been recognized for his exceptional contribution in this field. He is the recipient of the prestigious Dr. R.N. Datta Gold Medal in 2019. So definitely it's going to be a very, very informative session because we have a renowned dermatologist, Dr. Prateek Maharana, with us. So today in this session, we'll try to understand, what are the basic skincare routine that one can follow and keep their skin healthy, glowing, and less prone to acne. Even if you have an acne prone skin, or you are a teenager, adolescent, somebody who's attaining puberty, because that's the phase when a lot of hormonal changes takes place in our body, and I know most of us goes through that phase of teenage acne then. So we'll also try to understand what we can do in case we are into that phase. Plus those who have oily skin, who have acne prone skin, what should they do? Many times people who have hair related or scalp related issues like dandruff, fungal infection, they also experience acne on their forehead, on their backs, etc. So how can we prevent that, or in case we have them, what should be the treatment modality? So these are few things that we are going to discuss in this conversation, in this session with Dr. Prateek Maharana. We are just waiting for him to join, and as soon as he joins, we will have the answers of all these questions one by one. So today, as I said, this is also the Acne Awareness Month. June is known as the Acne Awareness Month. So today we are again here to discuss acne management, and we'll do that. So acne isn't merely a surface issue. It do, hamper our appearance, or it is a cosmetic concern to a length, that is true. But then deep down it also affects our confidence level. Many times people goes into depression because they are having acne continuously. And at times those who had acne, they'll also agree with me that treating acne is one thing, but then treating post-acne pigmentation, post-acne marks, scars, etc., they looks like the bigger challenge. So today we'll also try to understand that how to prevent ourselves from having these post-acne scars, marks, etc. And in case we have them, what is the best way to take care of our skin, and how to treat them is going to be one more topic that we will discuss today. So we are going to be joined by our skin expert of today, who is Dr. Prateek Maharana from Bargarh, Odisha. And before that, let me tell you that acne vulgaris is a chronic skin condition affecting more than 85% of adolescents and teenagers or young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigma surrounding acne. That's why July serves as an acne awareness month and spread awareness on acne. So today we'll discuss about acne and why it happens and how to take care of our skin. And now we are being joined by our expert, Dr. Prateek Maharana. Very warm welcome to you, doctor.
Very good evening to you.
So, Doctor, it's such a pleasure to have you with us today. And as we know, June is an acne awareness month, and we are continuously trying to spread as much awareness as possible on acne. Acne is something which is so common. And then we have people who have acne-prone skin or oily skin, or acne in adults are also quite common these days. And teenagers, people who are attaining puberty, they also go through that phase of acne vulgaris. So to start with, doctor, first of all, what is acne? Why it is caused?
So acne is basically an inflammatory condition. It is not a disease per se. So it happens whenever our skin produces extra oil, because our skin has multiple sebaceous glands in it. So whenever the sebaceous glands produces very much oil, so and it doesn't get excreted very well through your skin, it gets deposited and gets inflated sometimes, and sometimes it gets add-on bacterially infected. So this is the whole procedure of acne and becoming of acne and pimples.
Right. We see various grades of acne. Many a times it's very small, or white head or black head. That's what we know as layman. And then it can be as big and as painful as possible. So, what are the various grades, doctor?
So we clinically dermatologists have classified the acne into 4 grades. So in grade 1, we see that very tiny bumps on our skin that we call medically comedones, and in layman language we call it blackheads or whiteheads. So it's a grade 1, and later on the comedones has become the larger size of lumps, a greater size of lumps, which is red or inflamed. We call it papule, and is a grade 2. In grade 3, it is gets superficially infected by any bacteria like propionibacter of acne and others. And in grade 4, we see that this acne have become in size, greater in sizes, and becomes nodular or cystic. Whenever we palpate, we touch our skin, we can see that there is a lump beneath our skin, which sometimes is very painful and becomes swollen like a cyst. So it is a grade 4 acne. So apart from it, many other acne, forms of acne is there. Like acne is a condition that we see during the teenage and puberty, but acne can happen in uh, extreme of ages also. In infants also we can see acne. This is called infantile acne due to the
Oh, okay.
yes, due to the due to the hormones that pass from mother to child. And in extreme of ages, like in normally we say acne till the age of 25, right? So after the age of 25, acne can be seen, like in 30s or 40s, due to some hormonal imbalance. Those we call acne tarda. So these are some few form of acne. There are many other form of acne, other types of acne like drug-induced acne, like people who take steroids, oral steroids, or vitamin supplements, like, and protein supplements in gym. So in that cases, there are eruption of acne on the face or trunks. That is drug-induced acne, and like that.
Right. So there are various types of acne. And doctor, a very common tendency in our society is to go for home remedies, to apply something on the acne, or to go for over-the-counter topical applications. A very easy way because it's easily accessible, available. We go to a chemist shop and ask them, see, there is a pimple, give me something. And then we keep on using the cream tube, whatever the chemist recommends us. Only after a certain amount of time we realizes that this is actually, I mean, our skin is getting addicted to it. The moment we stop, we see more acne, and the quality of skin is also worsening. And that's when we go and land up in front of a doctor. So, I would like to ask you that how do these home remedies, or applying toothpaste or garlic, etc., or applying over-the-counter topical applications can harm us anymore?
So the over-the-counter medicines are readily available everywhere. So and these are very cheaper also. You can see that the one tube cost 100 rupees and lesser than that. And all these creams, OTC drugs, creams containing steroids, like some Pandem, Costum, Skin Light, Skin Scent. These steroids, what they do, they reduce the inflammation of any disease, whether it is acne or any form of skin disease. It will reduce the inflammation. So the redness and the inflammation of the pimples get reduced through the skin initially. So the patient will think that yes, the cream is working well, and the pimples are getting better. But whenever they stop this medicine, the disease gets reversed back. So what does the patient do? He or she will again apply it, and the cycle continues. Whenever he or she stops the cream, again the eruption starts, and then she applies it, then it gets reduced. So this vicious cycle goes on. So chronically, after using this kind of creams, the skins become thinner, and there will be tiny blood vessels that can be seen through this naked eye also, and there will be like eruption of small vellus hair over the face. There will be photosensitivity. Whenever we go outside, our skin will burn, and sometimes our skin gets dark also. So these are all side effects of this type of creams. We combinedly call it topical steroid damage phase. And coming to the home remedies, yes, I will not say that home remedies doesn't work. Yes, it will work, but it can be an add-on effect. So this is not a per se. This is the main treatment, mainstay of treatment of treating acne, but it will help additionally, like uh, those turmeric and honey and this aloe vera gel and this kind of thing. Yes, they help because turmeric has a good antiseptic effect. Aloe vera has good soothing or moisturizing effect, and honey is also having antiseptic and anti-inflammatory effect. And all these latest medicines have come derived from this Ayurvedic product also. So this sometimes may help, but you need to see your dermatologist. And because like I said, the grades of acne, your doctor will treat you according to the grades of acne. And in the home remedies, you can apply that multani mitti, because multani mitti will absorb the oil of the face, and turmeric, aloe vera, this kind of things. But yes, not to the OTC drugs.
Right. And doctor, when a patient comes to you with acne, are there tests that you normally recommend, or just by clinical investigation, you are sure that this is the acne and probably this is the cause?
The teenage pimples, this will happen to everybody, just like you and me. Everybody will go through this condition. So, like I said, it is not a disease; it's a condition. So, in those cases, we don't do any investigation to the people. But yes, if you are having acne in your late adults, or if you are having some your menstrual cycle irregularities, or any other hormonal imbalance like associated hair loss or associated extra hair growth on the other side of the bodies, like in those cases we like to do run some tests which will rule out PCOD, or polycystic ovary disease. What happens in PCOD? Your ovaries will produce more number of hormones, and because of this hormonal imbalance, and the acne got exacerbated. So in these cases, we rule out PCOD by doing some ultrasounds or blood tests, etc. But no, in the normal cases, we don't advise usually.
Right. And doctor, what are the treatment options available for acne?
So there are many treatment. There are baskets of treatment available. So we tailor it, we customize this according to the grades of acne, like I said. Initially, if you have some small minute bumps like blackheads and whiteheads, so only topical creams would help. But if you are having inflamed, secondary infected by bacteria, you can see the pus of painful acne. We do require sometimes oral antibiotics like doxycycline, minocycline, linocycline, etc. And in severe cases, like in nodulocystic acne, we give oral retinoids. And what this oral retinoids will do, it will exfoliate your upper skin. It will decreases the secretion of the oil gland that produces more number of oil to make acne. So these are all medications. Apart from it, we do latestly we do many procedures like comedone extractions. These small comedons can be extracted under sterile method through comedone extraction, and we do chemical peels also. So what are these chemical peels? These are like basically acids. There are salicylic acid and glycolic acid, mandelic acids. You apply even coat of acid over your face. It will gradually exfoliate the upper dead keratin layer of your skin. So whenever this oils get secreted and it doesn't get trapped, so it will naturally will flow out to the skin, and this acid, the salicylic acid, will go deeper into your skin and feed your acne. And other also procedures are like there, like we whenever there is a nodular acne, we give intralesional therapy. Whenever it is a cystic acne, we remove the cyst and do the phenolization. There are many things that you need to seek to your doctor.
Fair enough. Doctor, treating acne is one thing. Treating or getting rid of the marks or the post-acne pigmentation, scars, spits looks like the bigger challenge. So my question to you is, A, how can we prevent having those scars and pits? B, in case we have them, what are the procedures, that we can go for?
So better prevention is better than cure. So whenever you see that the acne is getting erupted, you try to use the topical creams with the help of your dermatologist. Then as soon as you treat your acne, the chances of the formation of the scar or the marks, that spots, will get reduced. That is the mainstay of the treatment. So because and we tell the patients not to pop up the acne. So whenever you touch the acne, you scratch the acne. Many people have tendency to excoriate the acne, pop up the acne. So this will lead to secondary infected, because our hands and nails are having numerous number of bacteria in it. So these areas will be infected through by bacteria, and it will lead further inflammation and scarring. So this is the main way of getting scarring and the marks. And after you get this development of this scars or mark, it will be very difficult to treat by us, because as they say that scars are forever. But there are, yes, the science has evolved many times nowadays, and we have many procedures to treat the scars like subcision, TCA, lasers are there, MNRF is there. So this all will help to reduce the appearance of the scar that has developed. And we do many surgeries also, like we remove the many the larger scars, and we do stitches, excise the scars. So this will always help. And for the pigmentation, again, with topical creams would help. We do peeling for the pigmentation or laser for pigmentation. Yes, but the prevention is always better than the cure.
Right. So scars are not anymore forever, but yeah, prevention is always better than cure. Uh, Doctor, because we are talking about acne, we are also talking about teenagers or young adults who have acne, and it's so common for them. Plus, we have those who have acne-prone skin or oily skin. So, for them, what should be a basic skincare routine that they need to follow?
So basic skincare routine for acne patient is just like the other patients, other people. So the three routines are there, as you must be knowing. So please say what are the basic three routine skincare?
Hmm. Cleanser,
Yes.
moisturizer, and sunscreen.
Yes. Everybody nowadays knows all these things. Cleanser, moisturizer, and sunscreen. Yes, this is all the basic skincare. Cleanser is the most important, because you need to remove your oil out of your skin, because the excess oil out of skin, and you can choose the oil secreting face wash, foaming face wash. Those are available containing salicylic acid, glycolic acid. This would help. And then after cleaning at least twice a day, because many people have habit they don't like wash their faces. So for them, at least twice a day face wash is enough. And then moisturizer, we can choose an oil-based oil controlling moisturizer. Your skin doctor would help you choosing that. And then a sunscreen on the top of that, a silicone-based, lightweight, matte finish face sunscreen with minimum SPF 30 plus and PA 3 plus would help in for the basic skincare of this patient.
Now, many a times, especially people who have oily skin or acne-prone skin, they feel that acne is happening because they have a dirty face or because they have excessive sebum production on their skin. So they keep on washing their face as much or as soon as possible. Is it a good practice, or as you said, 2 times is enough?
Two to
So
three
we should
times is
stick to that.
enough. If we overzealously wash our face more than required time, the normal oil will be also stripped up. So we have to balance. We have to keep the normal oil of the face. If we do excessively uh, wash our face using the face wash, our skin will feel dry. It will feel sticky and flaky, and people will also complain that because after using this face wash, I am having this kind of issues. So whenever you ask how many times are you using the face wash, they are telling like 4 5 times before going to bed, after the gym, after the swimming. They tend to tell all these things. So this is not a good practice. 2 to 3 times a day is enough to wash their face.
Yes. And for moisturizer and sunscreen, doctor, because oily face or people who have acne prone skin, they mostly avoid using moisturizer, saying that I'm already having such an oily face. Same with sunscreen. They'll say that I don't want to layer up, my acne with sunscreens, etc. So anything in particular to look for when we are going to buy a moisturizer or a sunscreen for, especially for acne prone skin people?
Yes, we can always choose a non-comedogenic gel-based product. Whenever you go to the shop and buy something from online, please check it must be written non-comedogenic, means it doesn't cause comedons or acne. And again, it's gel-based product because there are many products like their gel, cream, lotion, ointment, serum. So don't go all for all the products. Check for the gel based because gel based products are very lightweight and you don't feel that you have applied something on your face. It doesn't feel heavy on your face. So use any gel based product, whether it is a moisturizer or sunscreen. And don't use serum because many teenagers nowadays using many of serums, day serum, evening serum, night serum, with the help of this latest influencer on social media. And don't go for that because this serum will also aggravate the production of acne. Because what the serum will do, they will occlude your face and they will not help releasing out the normal sebaceous secretion. So don't use serum if you have oil-based acne-prone skin.
Doctor, as you said, people are also experimenting a lot on your skin with products because market is flooded with products. As you mentioned, influencers on various social media platforms are also endorsing products. So we keep on buying like so many products, and every month we are changing our products. So do such practices also, can lead to acne formation or worsening of our skin condition?
Yes, we every people have different kind of skin type, right? The products that has been endorsed by social media influencer or the celebrities, these are not recommended for every skin type because we have some skin type. I have some skin type, so this doesn't suit for all the patients. So frequent change of this skincare product will also aggravate the formation of acne. So I advise my patient less is more. Use less number of product, but consistently apply it. If you find it suitable for your skin type, then consistently use it. Don't use this product and that product after 1 month. This will harm you rather than helping your skin out.
Right. And doctor, any dietary precautions or any correlation between food or dairy products with acne formation?
Yes, you have mentioned the dairy products. Dairy products is in studies it is mentioned that dairy products, milk and milk items would aggravate acne because they release some kind of hormones like insulin growth factor, which will aggravate the formation of the acne. So apart from it, we can reduce the high glycemic uh, food in our diet. We can reduce the calorie diet. We can take low glycemic index food. We can take fish liver oil, omega-3 fatty acid, and healthy balanced diet. And additionally, this vegetables and fresh fruits and vegetables have lots of antioxidant, which will help for your smoother and healthier skin.
Right. Doctor, there are so many questions by our viewers. I'll just take a couple of them. So, Rishabh is here asking, Doctor, how can acne be managed in older adults?
Older adults, we would first address the why the acne is appearing in older adults, because acne is something that we see below the age of 25. So in older male or female, we need to rule out what is the cause behind it, whether it is a PCOD or other hormonal imbalance, or we can see that like you said, very wrong product if somebody is applying, and frequent change of face products, or using heavy makeup, excessive makeup. So these are some of the things we have to rule out. And using excessive hair oil, or if you are having excessive dandruff on your scalp, this will also aggravate your acne. So in old case, we have to rule out these things, and we give some medications for 2 to 3 months, and it will get treated.
Priya is here asking, Doctor, can acne impact a person's mental health?
Yes, obviously, because if acne will happen to me or you, we can manage it mentally. But if it happens to a teenage or an adolescent, this is very pathetic for them, because so yeah. So this is a phase
Yeah,
of
so
life.
motivated on, yeah,
But
right.
we need to see
And Doctor, before
conservative,
we start,
because if you like think that yeah, this is an age related thing, this will come and go, we don't need to treat that. So this is a blunder, because this will again leave scars or pigmentation, like I said. So yes, this is a condition that happens in adolescence, but you also need it to treat it as fast as possible.
absolutely. And Dr. Prateek, before we sum up the whole session, any take-home message for our viewers?
Take home message is acne is a very common condition, happens to every person in their life once and all. And don't use the OTC products, and this is the main take home message. And what I will say, don't fall for these influencers, that whatever they say, don't take it with closed eyes. And yes, just wash your face, clean your face twice a daily. Use a basic skincare product, skincare routine, moisturizer, sunscreen. And whenever you have some symptoms, then do visit your dermatologist. And that's it.
Thank you so very much, Dr. Prateek Maharana. It was wonderful talking to you. Thank you for this very informative session. Thank you once again.
Thank you.
And viewers, thank you for joining us. Have a great evening ahead. Take care of yourself. Stay happy. Stay healthy. Goodbye.